When temperatures dip, Catherine Morrill makes sure her son's humidifiers are up and running.
We found that when we put that on, it helps to keep the cough at bay. And, just getting a little bit more moisture in the air helped them to kick the illness a little bit quicker.
She's onto something. Researchers with Harvard Medical School have found humidity can help prevent sickness and speed recovery. Dr. Stephanie Taylor and her team wanted to find out why infections spread so quickly in hospitals. They studied nearly 400 hospital patients, everything from the number of visitors to hand hygiene.
And then that's when we first found this relationship between dry indoor air and more infections. And we didn't believe it. We just thought, that's crazy.
Their research found when the humidity is low, infection rates go up. It has to do with microbes in the air. The ones that survive in dry environments and become airborne also cause viruses and bacterial infections. So hand washing cannot always protect you.
Your hands can get recontaminated from the air, from things settling out of the air onto your hands. And you don't even know it because you haven't touched anything.
A study from the Mayo Clinic had similar findings. During the winter, researchers put humidifiers in half of a preschool's classrooms. The number of kids out sick from those classrooms was 2/3 lower than the other ones.
So they found that the air had fewer infectious particles and the kids weren't getting sick. Don't be in dry air. Don't be in dry buildings.
There seems to be a lot of confusion in this whole aerosol versus droplet discussion, even in the medical community. So I thought I'd take a closer look. What actually is a droplet and what is an aerosol? They're different definitions, but it's most useful to differentiate them according to their behavior in the environment. Droplets are above 20 micrometers or microns in size. They're usually produced during things like coughs, sneezes, shouting, etc., and usually succumb to gravity, meaning that they fall down after traveling in the air for 1 to 2 meters. Aerosol, on the other hand, is made up of fine particles under 10 microns in diameter, and they can travel for many meters before they fall to the ground or some other surface. So an aerosol is below 10 microns and can travel far in the air. Droplets are larger than 20 microns. They usually succumb to gravity and fall to the ground, and then there are the in-between sized particles of 10 to 20 microns that can have somewhat of an intermediate behavior, but are generally thought to fall to the ground like droplets. And there's an even more granular distinction between the different aerosol particles. Those below 5 microns are so small that they can travel all the way down into the alveolar space where they can cause pneumonia, whereas particles below 10 and above 5 microns can only penetrate down below the glottis and are thought to land somewhere in the tracheal branch. When droplets fall on surfaces, uninfected individuals can pick them up and by touching their face can get infected. That's why hand washing is so crucial. To make matters more complicated, when the water component of droplets dries up in the air, when the wind and temperature conditions are right, the remaining bits of floating virus are called droplet nuclei, and these can then behave like aerosol too. Also, when wind conditions are right, even droplets might travel much further than 2 meters. When you go to the ocean on a windy day and feel the sea spray on your face, you've just encountered droplets that have become airborne. What does that mean for COVID-19 or influenza? Well, it means that actual suspension times of droplets will be far higher when there are significant cross flows, which is often the case in healthcare environments, with doors opening, beds and equipment moving, and people walking back and forth constantly. So the general wisdom is that for stuff that flies around in the air that we must inhale in order to get sick, we need masks to protect ourselves and others. When we're dealing with droplets that are falling to the ground and on surfaces called fomites, we need hand hygiene and we need to keep a distance. So what about COVID-19 and the SARS-CoV-2 virus? Is it airborne and inhaled, or droplet-based via fomites and hands? Well, the uncomfortable truth is that we have evidence for both, which
Researchers have used the Fugaku supercomputer to model the emission and flow of virus-like particles from infected people in a variety of indoor environments. Air humidity of lower than 30% resulted in more than double the amount of aerosolized particles compared to levels of 60% or higher, as seen in simulations released on Tuesday by research giant Riken and Kobe University. Their findings suggest that the use of humidifiers may help limit infections during times when window ventilation is not possible. The study also indicated that clear face shields are not as effective as tighter fitting face masks in preventing the spread of aerosols. Other findings showed the number of singers in choirs, for example, should be limited and spaced out. There has been a growing consensus among health experts that the COVID-19 virus can be spread through the air. The US Centers for Disease Control and Prevention revised its guidance this month to say the pathogen can linger in the air for hours.
It's Dr. Shirley with Level Up Healthcare. The FDA has put out some warnings on some disinfectants and some hand sanitizers because of toxic exposure and illnesses. My cousin, who is a dentist, who's all up in people's faces, is at extra risk of contracting COVID. He's been using hypochlorous acid in order to disinfect surfaces and in order to keep himself safe. And I have been doing some reading on this substance. It is approved by the US EPA as a substance that kills COVID. This is something that's non-toxic to surface contact. It is non-corrosive. It is effective at killing viruses and microbes. The way hypochlorous acid works is by disrupting the outer membrane of viruses and then deactivating it from the inside. It is made by running electricity through water and salt. Afterwards, you can use vinegar to adjust the pH. This is amazing. This is something that our body makes. Our immune system actually makes hypochlorous acid in a way that actually kills microbes inside our body. This is something that we want to use because it is non-toxic to touch. I want to emphasize that because we absorb things through our skin and we want to reduce our toxic exposure because that's important to, it's important to functional medicine that we do so.